Aloha, everybody. Thank you so much for joining today's webinar, COVID-19 Vaccine Updates. My name is Dr. Shilpa Patel, and I'm here today to facilitate today's conversation. This Hawaii Pacific Health webinar event is focused on providing information to the community about Hawaii's vaccine timeline, the vaccination process, and the science behind the vaccine. We'll also consider questions submitted by registered participants of today's event prior to the event as well as during the event. But before we get started, a few reminders for our reviewers. Today's webinar will be recorded, and after the event is complete, registered participants will receive a copy of the recording. The event will also be available to view on our social media channels and website. For those joining us live, please feel free to submit questions using the Q&A button at the bottom of your screen. We'll do our best to answer as many questions as we can during the Q&A portion of the event. So moving on to the program, we're very lucky today to have several experts joining for today's discussion. Dr. Melinda Ashton is the Executive Vice President and Chief Quality Officer at Hawaii Pacific Health. Dr. Sarah Kemble is the Acting State Epidemiologist for the Hawaii Department of Health Disease Outbreak Control Division. And Dr. Axel Lehrer is an associate professor in the Department of Tropical Medicine, Medical Microbiology, and Pharmacology at the University of Hawaii John A. Burns School of Medicine. So, Dr. Ashton, as a mass vaccination site leader for Pier 2, would you mind describing the setup and some of the high-level insights from the past month?
Sure, be happy to. So we set up and started immunizing folks at Pier 2 at middle of January. And we've been seeing between 1,500 and 1,800 people per day receiving their vaccines Monday through Saturday. We currently have already delivered 44,100 doses of vaccine to willing recipients. And the process is going really well. Pier 2 is a big, wide open space, which makes it very easy for us to move large numbers of people through without anybody feeling crowded or worried about social distancing or any of those kinds of things. We've got a lot of space, and we rarely have a line either at registration or even while waiting for vaccines. So the most common period of time that people spend there from start to finish is just over 30 minutes. And that's with 15 minutes of mandatory post-vaccine watching. So after you get your shot, we ask you to sit and wait for at least 15 minutes. And even with that, the whole thing only takes about 31 minutes. So we're really pleased with how it's going.
That's great. And now that we have two different vaccines available to us and possibly a third one in March, do people get to decide which vaccine they'll receive?
Right. We do not allow people to make a choice on vaccine. We actually almost exclusively so far have been using Pfizer vaccine. The other one that's currently available is called Moderna. And those are very, very similar. We actually had a couple of days where we had Moderna vaccine, not Pfizer, and we don't mix. It's safer if we know that we're doing all of one or all of the other. So whichever day you schedule for your first shot will determine which vaccine you get. And at Pier 2, it would most likely be Pfizer.
I see. And Pfizer and Moderna both have different second shot timelines.
Right.
Can you talk about that a little bit?
Sure. One of the reasons for not wanting to mix and match vaccines at the same time is that they do have a different schedule for the second dose. So Pfizer is recommended that it be given at least 17 and more commonly 21 days after the first. And Moderna is 24 to 28 days after the first dose. So because of that, we don't want to mix and match. We're very careful to make sure we schedule your vaccine dose at the appropriate time after the first. Now, there is a range though. So people commonly say, oh, it has to be 21 days or it has to be 28 days. It turns out it's not quite that rigid. And so occasionally there are reasons why it has to be a little longer, and up to 42 days is considered okay for either vaccine.
Okay, so if we have to delay second shots because of the weather issues that we're hearing about on the mainland, it would be okay to push the second shot
Right.
out.
Right. I mean, it's a little bit complex to reschedule appointments. That's the major concern, but not impossible. And so if we do need to delay, there's no reason to worry about having to start again with your vaccine doses or anything like that. And actually, even longer than 42 days, it's still considered safe to just give the second dose and not repeat the first.
I see. Okay, thank you. Dr. Kemble, would you mind talking us through how vaccine distribution is going in Hawaii, and especially in terms of how it compares to other states in the US?
Sure. Can you please show slide 2? Thank you. So this is from the CDC website, and I've got Hawaii circled here. Somehow we're floating south of Texas as per usual, but we are really right there in the center with all the other states with getting doses out. We're in that teal group that's administering 15,000 to 20,000 doses per 100,000 population. So I think we're in pretty good standing there with getting doses out. And there's one other slide I wanted to share. Next slide. This is our summary of vaccination progress, which can be found on the website at hawaiicovid19.com or at the DocD website, which I will show later on a slide for those who want the URL info. But this gives you a snapshot. This goes up every Wednesday right now to show how many doses have been ordered, how many received in the state, and how many have been administered so far. So for those that are interested in tracking progress for the state, you can take a look here and see what the updates are each week. Right now, in terms of the population in the state of Hawaii, we're at about 12.5% for the state as of Wednesday. And for those 75 and over, we're over 55%. These numbers that we can show here are missing some of the doses that are going out through the long-term care program and federal pharmacies. So we know we're actually higher than that 50% for the state, 55% for the state. Thank you.
Thank you. And dovetailing on that, Dr. Kemble, would you walk us through the different phases for the vaccine rollout and how this is being decided?
Sure. Could I have the next slide, please? So this is a visual for the vaccine timeline. We are basically following the Advisory Committee on Immunization Practices guidelines. They had reviewed all the vaccines when they came out and made recommendations for use. And they've also made recommendations on prioritization. There are several objectives that we are looking at, and when we think about vaccine prioritization, and that's both at a national level and at a local level. We review those recommendations as well and make sure that we agree. One is to make sure that we have a functioning healthcare system and other essential services. And that was really the emphasis in phase 1A, which was primarily healthcare workers and in nursing homes. There's also very important objective of preserving life. And that's really the focus on our kupuna and those groups that we know have been most severely impacted in terms of outcomes of COVID-19. And then finally, it's very important that we look at strategies to stop transmission of COVID-19. So that is also consideration when we think about the phases. We're now well into phase 1B. This is the first responders, frontline essential workers, and kupuna 75 and over, and also correctional facilities. And we are looking to be moving into 1C fairly soon. I would say come early March, we should be seeing the next groups that we're able to open up to. So right now we're actively in phase 1C planning. Thank you.
Thank you. So you're suggesting that we might hear more about 65 and older once we're actually in phase 1C, and that might be as early as early March.
The timeline is looking good for that, but we will have more information in the coming weeks and in advance of when the actual date is, so people will know how to get signed up.
Okay, great. Thank you for answering that. That was a very popular question, pre-registration, and I can see on the Q&A that multiple people have asked that as well. Would you mind talking a little bit about who qualifies as a frontline worker or a frontline essential worker in terms of the vaccine at this time?
When we think about essential workers, our focus is on, first and foremost, I think healthcare workers were the prime example, those functions that are life-saving or life-preserving, and also workers who may need to interact directly with sick patients or the public and be put at risk for COVID because of that type of job. There's also consideration for jobs that may have less direct contact with the public, but do have to interact with coworkers in their day-to-day jobs and are therefore also at risk and serving critical functions. To be honest, the group of essential workers is varied and complex, and it is a big job to go through and try to make ethical decisions throughout about the best prioritization. In many ways, our goal is simply to keep moving through all of these groups because the end goal is to get all of these people vaccinated. And the exact order in which it happens ends up being less important as long as we can continue to move through all of those groups. And that's really the goal, is to keep everything flowing smoothly so we can reach everyone who wants a vaccine.
Thank you. Dr. Campbell, is there a place that we can recommend people go to get up-to-date information about moving through the different phases?
Yes, could you show slide 7, please? So there is information on hawaiicovid19.com about the Hawaii vaccination efforts. And there are links there to direct you for how to get registered if you're eligible for the current phase. A lot of the current phase is focused on kupuna, and we do have registration sites for that, and are also working to make sure we reach those kupuna who have difficulty registering online. So we have outreach ongoing to kupuna through other means as well, to make sure that nobody is left behind. For essential workers, there is also a link from this website for organizations that believe they have essential workers who should be in this phase. So please make sure your organization has signed up through that link on the website. And as we move towards phase 1C, we will have more tools up and more opportunities for registration as we get that information out there.
And Dr. Campbell, does it make sense for essential businesses that are identified in phase 1C to complete the online survey now, or to wait until further notice?
If you're not sure, just go ahead and complete the survey so we can help to make that determination.
Okay, thank you. Dr. Lehrer, would you mind walking us through a little bit of how long it takes for the vaccine to work after receiving it, and whether there's immunity after the first shot?
Yeah, thanks. That's a very good question. Typically our immune system takes a few days to kind of kick into high gear and give us protection. So usually between 10 and 14 days would be ideal. So after 2 weeks, we typically see the best response. Then, of course, the question is, will one shot be enough? For the current vaccines, as you know, you need to go and to get a second shot. And as was discussed before, the window to get that is a little bit wider than what the initial kind of rules were. But you do actually see protection. So for the Pfizer study, it was shown very clearly that about 10 days after a single shot, the numbers of cases actually dropped off in the large phase 3 study. Similar data was seen for the other vaccines. So that's really good news. I mean, I have to say these are is really excellent data that we've seen on that.
That's terrific. Thank you. And that really speaks to what Dr. Campbell brought up about trying to get people vaccinated, regardless of which phase they may fall into. Dr. Ashton, in terms of people who work in healthcare, Are HPH employees required to get the vaccine?
No, we are not at this time planning to require our employees get vaccinated. We have made it as convenient as possible for them to do so. And we've got about 3/4 of our workforce have already had at least the initial shot. Many have completed the series. So we are not seeing a lot of hesitancy. That's probably better than we get for the flu shot most years. So people are interested in taking the vaccine, but we're not going to require it at this point.
Okay. And once, is there a time where healthcare workers can change the PPE, the personal protective equipment that they wear?
Yeah, we're all looking forward to a time when that might be the case. Right now, it is not. And partly the reason for that is that we've got people who are vaccinated and people who are not, and it's somewhat difficult to tell by looking at someone whether they have or haven't had the vaccine. We don't want to pull back from all of our personal protective equipment before everybody's vaccinated. But also the science is still a bit young on whether in fact the ability to carry the virus in your nose is sufficiently reduced by being vaccinated that we could be safe without masks and so forth. So right now, everybody will still be masked for the foreseeable future. And we think that's fine.
And would that apply to social distancing as well then?
Social distancing, getting together in large groups, all of the same rules that we've been talking about now for almost a year still apply, even if you're fully vaccinated.
Thank you. Dr. Kemble, thank you for showing us how Hawaii stands up against the rest of the country. Would you mind speaking a little bit about our neighbor islands and how vaccine is being distributed across the neighbor islands?
Sure, I have a slide for that too. Thank you. So this shows the allocations by population for each island. And so the top number in teal is the population for each island. And in orange under that is what % of the state population that represents. And then the dark brown color is the % of allocation of vaccines received so far throughout the state. So we're watching these numbers closely, and they really have not shifted dramatically. So the good news is we're keeping pace and getting allocations out pretty much in proportion to the population of each island. And that is a general goal, is to make sure we have a population-based distribution to the neighbor islands.
Thank you. Dr. Ashton, you mentioned that you don't have 100% vaccine rate at HPH or in the healthcare setting. Could you talk about that a little bit? Is there vaccine hesitancy?
I think actually we experienced a lot less hesitancy than we had expected potentially at the beginning. As people were talking about these vaccines, and they're particularly the ones we have now are brand new technology, there was concern that healthcare workers would stand back and wait. And in fact, we haven't seen a lot of that. Our physicians are well above 80 to 85% now, I believe, of having received the vaccine. So that speaks very well to the acceptance that the science is clear and is convincing, and that people are willing to take it. I think there are always folks who would like to take a wait and see kind of an attitude. They want to make sure that others around them have safely navigated these waters and that they have come out the other end with, you know, and are well. And also because we're not changing PPE or anything else, the advantages for taking the vaccine seem to be somewhat less clear for some people. They have seen coworkers or others have COVID and not get very ill with it, or maybe not be ill at all, and they wonder about the value of the vaccine. And we know that the vaccine, I'm sure Dr. Lara will talk about this, the vaccine is better at inducing protection against COVID than a mild or asymptomatic infection is. So it's really important that people get vaccinated. And we continue to see those late adopters continue to gradually say, okay, I'm ready now, it's my turn now. And so I think we'll continue to see some uptake. And again, I don't think the hesitancy was less than I expected.
Well, dovetailing off of that, Dr. Lehrer, there's a lot of misinformation out there, especially on social media, that the vaccine gets into the DNA and other concerns that are, well, I'd like you to tell us, how do these vaccines actually work? And if you could talk to us about it in terms of some of these concerns that people have about them as well.
All right, thanks for that very important question. And actually, if I could have the slide, please. Dr. Ashton actually gave a very good introduction into this. One of the things that we know by now, it's only a year into the disease that we have studied it, is that mild infections actually don't seem to give you full immunity against this. And this is one of the reasons why we don't or didn't have any coronavirus vaccines until very recently. So let's just say, how does a vaccine work? So a vaccine basically is trying to do the same that the body will do in response to a natural infection. So it's kind of an education system for the, or an educational program for our immune system to tell it, okay, this is, the bad guy, and this is how we protect against that. So we don't want to, of course, make the patient sick, but it is important that a good, solid immune response is formed. So what our body needs for that is what is called an antigen. An antigen is typically a protein that the virus or bacteria will make. And then this antigen is delivered in different ways. And that's what this very complex figure shows. We are not going to go into all of this because otherwise we are going to take a whole semester long course here. But what is important is that these antigens are either made, when you look on the left, they're made by a live pathogen, which could be the CV here, the coronavirus, or an inactivated antigen right below it. Inactivated antigen would be something like the flu vaccine. So those are conventional ones that are given to our body cells. They're kind of these gray boxes here. And then, they're being processed and they go to the right side here where you see this kind of green star, the APC, that's the antigen presenting cell. And that's where basically the lecturing is happening to our immune cells. The immune cells now learn how this virus looks. And what our new vaccines that we have just learned about in the last months and that we're, hopefully all getting very soon are using is actually on the bottom here, DNA and RNA. So we use those molecules that are just basically the cooking recipe that tells our cells how to make this protein. So there's no virus involved. It is just really the recipe on how to make this antigen so our immune system can be educated, which is different from a conventional vaccine. As I just said, the IA, the black dot there, would be our classic vaccine. We have subunit vaccines. You see that on the right, these are vaccines like the hepatitis B vaccine, where we just give this protein to the cells. This is, for example, the vaccine that Novavax is developing. And then in the middle here, you see another class, and this is what is coming up. What is called VVNR is viral vectors that are non-replicating. This is what the Johnson & Johnson and also AstraZeneca shot will look like. It's a different way of delivering that genetic information to the cell, but it is not replication competent, meaning same thing as with the RNA. It's just put in the cells, gives it the recipe on how to make this antigen. And then in the end, all of the immune responses, as you can see, all the arrows lead to that green star. And that is really what's happening. It's a very complex process, of course, and typically it takes us years to decipher how it all works. The lucky thing for all of us is that for the coronavirus vaccines, the blueprint had been developed a little bit earlier. And so we saw these vaccines come very quickly. Thank you.
Thank you. So I love the analogy that you used with the recipe. So it's basically the mRNA vaccine acts as a recipe that then gets thrown out, right? It gets thrown out into the garbage. It's not incorporated into the food. It's just the brains behind the food our body ends up consuming.
Yeah, absolutely. I mean, that's the right analogy here. Thanks for summarizing that nicely.
Thank you so much for describing that. So, Dr. Ashton, how long does the vaccine protection last in most people, as far as we know now?
Well, we don't have enough time to really know, but we know that so far, we're very confident that at least 3 months of protection, and probably a lot longer than that. But because these vaccines are new, we haven't had enough time to study them a whole lot longer than that period of time. So the CDC currently says we're good for 3 months, and we expect that they'll add another month and another month and another month after that, as they have more time to observe the reaction.
Right. And based on what Dr. Lehrer just described, it seems like our bodies have sort of, they have the knowledge, the immune knowledge to protect us possibly into the future. But that remains to be studied, I guess.
Right.
Dr. Lehrer, there's, as you know, a lot of talk about new variants and new strains. What should we be concerned about in terms of the new strains of COVID-19?
Yeah, I think, let me start with that. I think there's really, it is a kind of a new topic that the media seems to really focus on. The similar things have happened before when, for example, the Ebola outbreak happened in West Africa. There's always first the question about new strains. But what we have to keep in mind is that actually coronaviruses are relatively slow to mutate. All viruses have repair mechanisms. So in comparison, for example, flu is about 2 times faster in getting mutants, and HIV is about 4 times faster. So it is not really the mutation rate that we're concerned about. The main concern is that usually the new viruses are what we call, they have gained fitness. That means they replicate faster typically, and then also affect the epidemiology. They affect how quickly the virus can spread. Because if you have more virus in your body, it is easier to transmit. And so as one example, and this is the only mutation that I can really talk about because it was well studied, was the one that occurred last spring. It first occurred in parts of Europe and then was spread throughout the world within just weeks. So, these kind of things can happen. And as we learn more about the viruses, as more labs are doing sequencing, we kind of catch it quicker. And that's why we know now these certain subvariants. But I would not be too worried about that from everything we know. But what is important, of course, is that vaccines will basically, good, well-working vaccines will help us stop this, because it just makes transmission events so much less likely.
And do our current vaccines work against the new strains of COVID?
And again, this is also a very important question. What we know is that all of the vaccines prevent serious illness, and that saves lives directly. As well, it means that there's less people in the hospital, which is good for all of us, because it means that those hospital beds are open for other things that also happen. I mean, it is not only COVID that are health emergencies for people. And it is definitely, that's what the media has told us now, and it is very big on that the efficacy is lower against certain strains. This is why South Africa has decided not to use a certain vaccine in healthcare workers, for example, because the efficacy to prevent the infection of the person that's vaccinated may be lower with some vaccines. But that is, not really the overall message that's important for every one of us. And so, yes, in general, the vaccines seem to still work against all of the variants. And of course, vaccine makers are already working on the next generation. Should this turn into the next flu, where we need to have seasonal adjustments of the vaccine recipe.
Thank you. Can you tell us a little bit about the new vaccines that are coming down the pike, the Johnson & Johnson, the Novavax, or the AstraZeneca? And you don't have to touch on all of them. Do they differ from existing vaccines in terms of efficacy?
Thanks. Also, that is, of course, something dear to my heart. The next vaccines that you mentioned are probably the Johnson & Johnson that we have heard has put in for emergency use approval and may get approvals by March, and people are already starting to talk about the supplies. These are using the adenoviral vector that I explained earlier. So it is basically the same situation. Our body cells make the antigen. The difference here is that this is it's an attenuated or a replication incompetent, actually, viral vector. And the nice thing is that this can actually be stored under regular refrigerated temperature. So that will be one thing that makes a difference. I'm sure that Dr. Ashton is particularly, interested in those things. The second thing that's really good is Johnson & Johnson is testing a single shot vaccine regimen. That means the complicated logistics don't need to happen, that you need to schedule everybody for 2 doses. We don't know yet how well and how long this vaccine will last. And what Johnson & Johnson has done, I thought that was really excellent, is they also started already a phase 3 trial with 2 doses. So in case it comes out that you need to get a booster shot sooner, then basically that will be rolled out right away. For AstraZeneca is also an adenoviral vector. This is the one coming out of England, and there's some controversial data about its efficacy levels. That will be 2 doses. That's already being used widely in the UK. And then the Novavax that you mentioned is a protein subunit vaccine. This is, of course, a very safe, very well-known platform. This is probably the one for people that are a little bit more afraid of side effects. This is probably going to be the safest there. The efficacy levels are excellent for that, what we've seen. Novavax just announced this week that they have fully enrolled their phase 3 trial. So I really hope that within a month or 2, we will hear results on that, and then hopefully also see this vaccine come to Hawaii very, very soon. And again, to summarize, all of these vaccines are efficacious. The levels may be slightly different when you talk about different isolates of virus, but that is not really relevant for us from a population. We want to reopen Hawaii. So that's what the message is. All of them will work well.
Thank you. Do people who have already had COVID infection need to be vaccinated? Dr. Ashton, would you mind answering that?
Yeah, I'd be happy to. The recommendation is to vaccinate people who've had COVID. As I mentioned earlier, people who had mild or asymptomatic COVID infections definitely need the vaccine. There's no question about that. People who've been more ill with COVID should recover, and they can delay being vaccinated for 90 days if there's supply problems, right? So if we would like to find a group of people that would have less risk of having COVID again, it would be that group, the more seriously ill COVID patients. So they could wait 90 days, but they don't have to wait 90 days. So we just need to make sure they're no longer infectious, and then they can receive vaccine. But it is recommended that anyone, even those who have had COVID, should be vaccinated. It looks like the immune response from the vaccine is better than from the disease.
Thank you. Dr. Kemble, for the people who are vaccinated, we talked about this in the healthcare workers, but what about just regular people? Can they change their level of mask wearing or social distancing? And why or why not?
Thank you. And I have a slide that could be shown. This is just a reminder and a visual. I get asked this question a lot after I get vaccinated. Will I still need to wear a mask? And the answer is yes, for now. And I think Dr. Ashton went into some of the reasoning behind that. But until we understand better whether transmission, asymptomatic transmission, is still possible after vaccination, and until we have a higher proportion of our population vaccinated, masks are still going to be really important, as is the physical distancing and avoiding large gatherings and staying home when you're sick. So even if you've had the shot, if you become sick with symptoms that are like COVID, it's still really important to stay home to protect others from yourself and avoid coughing on friends and family members, and to still get tested to make sure it isn't COVID. We hope to understand more in the coming months about how much benefit we do get from vaccination and at what levels. But in the meantime, it's still really important to keep all of these things in mind.
Thank you. And Dr. Campbell, what does the gains that we've made with vaccination, what does that imply for travel restrictions?
Travel is another area where we still have a lot of uncertainty, especially with the new variant strains. They do arrive here through travel because currently we have been performing surveillance for variant strains in Hawaii, and it's only recently that we've begun to see some of these new variant strains. And based on the genetics of those viruses, they do come from other parts of the world. So it's just a reminder that we are not safe necessarily from imported new strains, and that those could change the dynamics of transmission here in the islands. So travel is still an area where it's definitely being looked at. You know, can vaccine change travel guidance? It's possible, and I think that's being looked at very closely right now, but also with some caution to make sure that we don't move too quickly in a direction that may upset the balance we have right now. Right now, we're lucky to be seeing decreasing case counts, and we hope to keep it that way. And part of that formula is both getting as much vaccine out as quickly as we can and maintaining many of the mitigation measures that we have in place right now while we get through that vaccination phase.
Okay. And could you talk to us a little bit about what it's going to take in order for us to get to the point where we can relax our PPE, or mask wearing, and social distancing?
The easiest answer to that is herd immunity. At what point are we there? That's the scientific question that's being hotly debated right now, and we don't actually know. Numbers have been thrown out between 60 to 90%, depending on what's happening with variants and how well we're practicing mitigation in the meantime. But as we hit certain tipping points, we may begin to see reductions in transmission. And there are some reports coming from some of the dense urban areas of the mainland already that perhaps some areas between natural infection and vaccine are beginning to hit some of those tipping points. That's an encouraging thought. In Hawaii, we've been fortunate to have lower community transmission overall than many of our mainland counterparts. So I don't think it's likely that right now we're actually seeing the benefit of vaccine yet, but I do think I'm hopeful that we will begin to see it soon.
Thank you. Dr. Lehrer, are there any long-term effects of COVID vaccines?
Sure, that's a very nice question. Of course, we as vaccine developers hope that the long-term effect is that you're immune from the disease for a very long time. But of course, the main concern that you're playing to here is that people are looking at adverse reactions, side effects, and all of that is, of course, because we're looking at very new technologies, new vaccines. We only have a few months of data on that. But so far, I mean, the technologies have been vetted before. The vaccines have been used in many people. The adverse reactions that are short-term and short-lived have not, given any concern here that there's any long-term adverse effects to your health. As I explained earlier, I mean, I think the main message is that all of the vaccines that we're using, it is your single-use recipe that is put into the cell, and then the body studies it well and hopefully remembers and then controls the disease later.
Thank you. So we've had a lot of questions about whether people who have medical conditions such as cancer or autoimmune conditions, or who have received Botox or fillers, are they okay to receive the vaccine? And let's see, Dr. Ashton, would you mind responding to that?
Sure, I'd be happy to. There are actually very few people who absolutely shouldn't get the vaccine. And those are right now people who've been allergic to the vaccine, that vaccine itself. That's really the only absolute you shouldn't do it. So if you've had anaphylaxis, which is a very severe allergic reaction to one of these COVID vaccines, then you should not get another dose. Apart from that, there are a lot of cautions. So there are people with a lot of allergic reactions to things in general. We watch more carefully, but it's not an absolute, you shouldn't get it. For people with cancer, autoimmune disease, fillers, some of those conversations are better had with your own individual physicians about your concerns, but it's absolutely recommended that people who have immune compromise, cancer therapy, those sorts of things, they're more likely to have severe COVID disease. And so it's really important that they get vaccinated rather than avoiding it because they're concerned.
I see. And what about other vaccines around the time of receiving a COVID vaccine? What's the guidance on that?
Yeah, because again, the COVID vaccines are new, and so they haven't been studied in combination with, say, Shingrix or flu vaccine or any other vaccine. So the current recommendation is to avoid having another vaccine within 14 days of the COVID vaccine. So try not to get your flu shot within 2 weeks before the COVID or 2 weeks after. It's a relative concern. It's probably not an absolute one, which means if it happens that you have 2 shots within that same period of time, it's probably okay, but they've not been studied. And so it's just a recommendation that you try to avoid having another vaccine within 14 days of the COVID vaccine.
Okay. And then last question, are there medications that might decrease the effectiveness of the vaccine? There's information out there about Tylenol before or ibuprofen before and or after.
I guess I'll take that one as well. It turns out that there are a lot of people willing to say a lot of things about what you should and shouldn't do around this vaccine. The science is pretty limited. There is a concern that has been in the media that says if you take ibuprofen or Tylenol prior to the vaccine, you might somehow interfere with your body's response to it. That's probably not well grounded in science. So if you happen to have taken Tylenol before you got your shot, don't worry. I don't think that's anything to be concerned about. Additionally, there's been some advice that you shouldn't take, Tylenol or ibuprofen after the shot because you might mask your reaction to it. And again, that's someone willing to give that recommendation, but it's not based in science. So as far as we know, there is no contraindication either before or after the vaccine for either Tylenol or ibuprofen. So particularly after the vaccine, if you've got a headache or a sore arm or whatever common reaction to the vaccine, it's perfectly okay to take whatever you're normally used to taking for fever or pain.
Thank you so much. Well, we are all up on time. I'd like to thank you all so much for your expertise during today's program and to our viewers who are watching at home. We hope you were able to take away some helpful information from our panelists on the COVID-19 vaccine update today. So for more information on the vaccine and Hawaii Pacific Health's efforts to support our patients and the community, please visit hawaiipacifichealth.org. Thank you again for joining us today, and we hope you stay safe and healthy. Bye-bye.